Hello, this is Dr. Carl Hansen. This is a two-part video. The first part is on how to prevent and treat viral illnesses during the cough cold season and frankly any time of the year. The second part will be on vaccinations and immunizations. The second part will be on my Rumble channel for obvious reasons. So after you watch this, then you could go to the Rumble channel and catch the second part. Or you go to the Rumble channel and catch part 1 and 2. So what we're going to start with here is just the disclaimer that this is not your personal advice for you. I think that every patient should be able to talk to their own personal primary care physician and discuss risks and benefits concerning any sort of medication treatment, including viral treatment that I'm going to talk about, immunizations, etc., and a lot of different things. That's the hallmark of medicine, or it should be. So our first thing we're going to talk about is immune health. There's a lot of products that you can take and things you can do to improve your immune health, but none of them are expensive. We're talking about making sure your vitamin D levels are good, which you can check with a simple blood test and a cheap blood test. Also supplementing yourself with adequate protein, getting adequate exercise, sunlight exposure, keeping yourself healthy, good sleep, to bolster the immune system. So don't go look for a whole lot of nutraceutical products that are specifically immune boosters. That's not the concept I'm going for. Now we're going to talk about how to prevent a viral illness should you come into contact with somebody who's coughing and snorting and sneezing and you're liable to catch something from them. This is a common scenario for me because I see patients in my office who have a respiratory illness, and after I see them on that day, there's a certain protocol I do for a few days thereafter. That protocol is as follows: two things. One is a nasal wash. That is spraying if you feel that you've inhaled other person's viruses, crowded airplane, crowded room, coughing, snorting person, then you want to use some sort of nasal wash. That could be nasal irrigation. That could be repeated doses of just saline nasal spray. That also includes what you've heard before from me, is using betadine, povidone iodine solution diluted down to 1% or less, where you can spray in your nostril and sniff it really in the back. And another item is xylitol, Zylitol. That's also it comes from the form of X-Clear and some other brand names, but it's also a nasal spray that has the capacity to reduce the viral load, not eliminate all viruses, but to reduce the viral load and to maybe neutralize some of the viruses. Remember, if you have a billion viruses in your nasal cavity, that's a lot worse than having 1,000 viruses in your nasal cavity. So if you can markedly reduce the count, that matters a lot. So those are the typical things that I would recommend from a nasal wash standpoint. Gargles are the second component of this preventative measure. So if you've been in this crowded room, see somebody talking to your face, coughing, then gargle with Scope, Listerine, anything with thymol, Thymol, in it. And anyway, do the sprays and the gargles for about 4 times a day for at least a few days. And the gargle should be about a 30-second gargle, maybe 40-second gargle. So you're really clearing out, gargling the back of your throat. So that's the method I used for prevention of getting a viral illness, even though I've been heavily exposed to the virus. Now let's translate that to acute treatment. Let's say you were in the crowded room, you forgot to do all this stuff, and a few days later you start having congestion, runny nose, postnasal drip, a little sore throat. Then you immediately do the same thing. Nasal washes, irrigation, saline nasal sprays, 1% betadine nasal sprays, xylitol nasal sprays on a repeated basis. Gargles 4 times a day, at least 30 seconds per gargle, to help get rid of some of those viruses that are in your nasal and your oral pharynx. So again, even though you've started with an illness, that illness is going to build. If you can decrease the viral load, then you're going to have less propensity for this to manifest itself as something. So this has made a marked difference for myself and other family members as far as catching something. So even if you feel like you're coming down with something, it doesn't go on and become a 3-week-long viral illness. Yes, you may have feeling a little bad for a few days, but you really attenuate the actual illness itself. So if you get this viral illness and you're feeling bad and you're using the nasal and the gargle approach, and you're still not feeling great, there's some other things that you can do. And I would even advocate doing this even at the same time as initiating the gargles and the nasal sprays for an acute illness. Aspirin is a good thing for people that can take aspirin. Not everybody can. Vitamin C. Now, this is high dose vitamin C. It's probably 3 grams a few times a day. We're going high dosages at least. Vitamin D. I think vitamin D, if you already know that your vitamin D levels are really good, you probably don't have to do that. If you're not sure, start taking vitamin D. My preferred vitamin D is actually K2, D3, but if whatever vitamin D you have around, you may take 20,000 units a day for about 5 days or something like that to really build up those levels. You're not going to be doing that for the long term, right? But just for several days. Zinc, if you were taking zinc, let's say 25 milligrams a day, get ill, bump that up to 50 milligrams a day. Again, for several days, not indefinitely, because it could have effects on the absorption of copper and some other metal ions. Some other items that I use actively to treat is famotidine or Pepcid, high dose, so 40 milligrams twice a day. Famotidine, it's an histamine blocker, but it also has some anti-inflammatory effects. And then also there's a product which is over the counter called quercetin, Quercetin, comes 500 milligrams. Let's say you take that twice a day. That's sort of a poor man's hydroxychloroquine, the best way I can put it, just for our discussion. So all those over-the-counter items, D, C, zinc, famotidine, quercetin, taken for several days during the initial phase, does help with these illnesses. And let's put it this way. They may not be proven in a double-blind, randomized, controlled trial, but they are certainly safe products, and there is evidence of their benefit. They may never be subjected to vigorous or rigorous trials. So if you're armed with nasal washes, gargles, and then have to use some of these over-the-counter products, you should be able to abort or minimize pretty much any significant upper respiratory viral illness. And I'm talking also about the SARS-CoV, the COVID, these influenza. And I'm just talking about rhinovirus or adenovirus. We're talking about all these respiratory viruses that inhabit your nasal passage and your oral pharynx. If you still get worse after this, then we get into prescription items, which I'm not really going to get into much this time. You would contact your physician about that. Items such as hydroxychloroquine, ivermectin, cyproheptadine, which is an antihistamine derivative, and then doxycycline and azithromycin antibiotics to cover certain secondary bacterial infections that we see. But that would be a consultation one-on-one with your physician that would require a prescription. So that's my general advice going into the cough cold season. Stay away from people that are sneezing in your face, but sometimes you can't avoid it. If you get exposed, go over the treatment, nasal, gargle, things that I recommend. If you actually feel like you're coming down with something, boom, again, nasal, gargle, and then consider adding those other products that I listed that you can get over the counter. And consult your physician for your particular instance of what you should do, what over-the-counter medicines you can take, etc. So thank you for listening. If you would like to see part 2, which is my discussion on necessary vaccinations or immunizations, it is on my Rumble channel. Here is the link where you can find that and the title slide. You can go over to that and get some information on my opinions about shots for the cough, cold and flu season. All right. Thank you very much for listening, and we'll talk to you later. Bye.